We are following Germany's COVID-19 crisis, and Chancellor Angela Merkel is preparing now to take questions from journalists on her government's COVID-19 strategy. Let's go right to that press conference and see if we can listen in to the Chancellor's words as she gets started.
The federal press conference. We are independent. We are not part of the German government. The Berlin Parliament journalists are usually here, which is why these press conferences are organized and chaired by journalists, which is a tradition for a long time. And we're pleased that you are here again, Madam Chancellor. I think you were here 3 times, and we're pleased that you are following that with the first month of the year. You have the floor, Madam Chancellor. Ladies and gentlemen, we find ourselves in a very difficult phase of the pandemic, and this was the reason why the heads of state and government of the federal states and the national government continued their deliberations on Tuesday and didn't wait until next Monday as originally planned. And that is also the reason why I am once again here, and very happily so. I want to give you a sense of my analysis and evaluation of the situation, and then, of course, respond to any questions you may have. And I want to thank the Federal Press Conference for inviting me to do so. We find ourselves in a very difficult phase of the pandemic. And why is that the case? Because we have a bit of a fractured image. On the one hand, we're seeing the daily number of infections declining. Finally, that's the good news. And there are fewer people on our intensive care wards than there were around Christmas and before Christmas. This is good news as well, because since the beginning of the pandemic, it has always been about not exceeding the response capacity of our public health systems. It's not just a medical question. I've said this often enough, but I'll repeat it again. It's not health or business, health or education, health or culture. They're not a contradiction in terms. Exceeding the response capacity of the public health system serves the people, it serves business, culture, the economy, everything. And we cannot imagine often enough what would happen if we were to wait with the measures to tighten them up, or if we had waited in the past until our ICUs were overfilled. That would have been too late. And this is why it is very necessary and very encouraging that the current situation is easing a bit. That shows that the tough measures that people in Germany have had to live under for weeks now are starting to pay off. And it shows that it's worth the effort. And I can only once again most cordially thank all of the efforts of the people in this country for pulling together. We know that this virus is very hard for all of us to bear. But I said at the beginning that there was a sort of a fractured image, and that was the good news. On the other hand, we're also seeing shockingly high levels of mortalities. Today, again, over 1,000 people dead. These aren't just numbers. These are people who died alone. These are people's lives. These are families grieving. And this is something we need to bear in mind again and again. And above and beyond that, one of the things we're struggling with at the moment is that all of the efforts we are putting into place to contain the virus cannot exclude one real risk. And this risk is something we can see more clearly now than we could at the beginning of the year, and that is the mutation of the virus, particularly in Britain and in Ireland, but also in Denmark and the Netherlands. And we have cases of it here as well. Based on what we know so far, the mutant strain of the virus is considerably more contagious than the one we've been living with for the last year, and that this is the main reason for the new shocking rise in cases in Ireland and Britain. This mutant strain has been detected here in Germany, but it is not dominant. And all the same, we must take the serious threat from this virus very, very seriously. I cannot stress this strongly enough. We need to slow down the spread of this mutant virus. We mustn't wait until this virus flares up here and is reflected in explosively new rises of cases. Then it would be too late to have an even stronger wave of the pandemic, probably a stronger one than we've seen so far. We can still prevent it. And this is why our consultations with the state premiers the day before yesterday focused on this. There's still a little bit of time to try to prevent the danger that this new strain of the virus means. So it's about precautionary measures, and this is why the national government and the state governments have decided on tighter measures to bring down the cases, the caseload that we have here in Germany before the mutant strain of the virus spreads even further. This evening, at the video conference of the heads of state and government of the European Union, this mutant strain will be of focus. We'll be talking about this mutant strain. We'll be talking about how we can ensure that we have similar measures in place across the European Union to combat the spread of the virus, because in epidemiological terms, as the European Union, we are one area. We'll also be talking about sequencing to get a clear overview of the mutant strain of the virus. It will also be the subject will also be vaccines and other aspects of this. We are therefore taking precautionary measures for our country, precautionary measures for the health of the people in this country, and therefore automatically it's a precaution for our business, for our culture, for our environment. Because if we see explosively high spreads of the infection, this will overwhelm our hospitals. Everything we are doing, to put it another way, is aimed at containing the pandemic and overcoming it. So I'll stop at this point and respond, hopefully, to your questions. Thank you very much. There are plenty of questions. Many people in the room have asked for the floor, so I'm already having to warn people that we're not going to be able to ask and answer every question, because as in every press conference here, for reasons of the virus, we are limiting ourselves to 1 hour. After that, we'll have to stop, because at this press conference, we want to sit people down as far apart from one another as possible. So for the reasons of the pandemic, I'd like to ask you to keep your masks on when you ask your questions. Mr. Feldhoff is also going to be asking some questions that we have as well. And let me remind you that the rule is 1 question and possibly 1 question of clarification afterwards. Mr. Lose, Mr. Lange, and Mr. Merkmeyer. Mr. Lose, where are you? Mr. Lange, actually, we'll start with you since you're further away from the mic. I've got a question for you. Sorry, there's a technical problem. We can't hear this question very much. But essentially, it's about the discussion that was just had between the government and the regions. I think that the decisions that we have made have always been on the basis of consensus. Obviously, it's not the case that it's the national government and the federal state governments. That is not appropriate. There are many different views among the different state premiers, and we find a balanced agreement. I very much appreciate these discussions that we have, even if they take a lot of time and they are quite laborious, but because we arrive at agreements that everyone can support. And I think that's what the people in this country expect from us. If there's sometimes a bit of frustration among the people in Germany, then that's because we sometimes do not speak with one voice. And I would like us to do that as much as possible, which is why it is important to have these negotiations. And many of the things that we agree still have to be implemented in the federal states. We're a federal country, and I appreciate this cooperation, even if it isn't always necessarily simple, but that's part part and parcel of policy making. In the coalition agreement meetings that we have, it's not always that easy, or interministerial coordination isn't that easy either. It's just part of the job.
Okay, if you're just joining us, Chancellor Merkel there has been speaking here in Berlin on the COVID-19 crisis in Germany, answering a question there about her government's approach. And Germany has extended its lockdown until February 14th. It's introduced some new tougher measures like more working from home, also medical-grade masks in shops and public transit. And we heard the Chancellor there say that it's a difficult phase still, even though infection rates are starting to drop in Germany. Well, our political correspondent Jared Reed has been listening in to the Chancellor's words with us. Hi, Jared. It's good to see you. Tell us more about what the Chancellor had to say about the state of the pandemic right now and also her government's approach.
Well, as you say, Angela Merkel repeated that we are in a difficult phase of the pandemic right now. And she said that there is a sort of fractured image where it's encouraging that there are fewer people in intensive care and that the 7-day infection rates are dropping and that all this hard work is starting to pay off, as she said. But there is the other side, the shockingly high level of people dying every day. I mean, today, for example, we had over 1,000 deaths, over 20,000 infections, these consistently high infection levels that aren't really significantly dropping. And she's saying that there is a real risk of these mutations of the virus that are seen in the UK and South Africa, and there are also reports of one from Brazil. What this could mean for all the hard work that has led up to this point, and she doesn't want all of that hard work to have been in vain, basically saying that she wants to prevent these strains that we've seen isolated cases in Germany, but to prevent these strains from becoming dominant here.
Did she give any indication, Jared, about where the situation goes from here, whether the German government's considering extending the lockdown even further or whether there's a light really at the end of the tunnel?
Well, she didn't really say that, but she did talk a lot about these negotiations between the federal government and the states, which have been quite laborious. And what she has found a little bit difficult is she has sort of advocated for the go tough, go early approach. I guess she's seen this in all this coming, but she's met with resistance from the states who have been worried about the economic impacts of tough measures on their economies, also the social and psychological impacts, particularly on schools. But what Angela Merkel said, that is there are many different views. She appreciates these views, but she would like German leaders to speak more with one voice going forward.
Certainly, Jared, there's been some criticism over the vaccine rollout here in Germany. Did she discuss that and tell us a bit about why this vaccine rollout has been slow?
I think that's to come in terms of the reporters' questions. But what we do know about the vaccine rollout is that it has simply been hampered by a lack of production capacity. And what we've heard from authorities in the last week is that when more start to get produced, then more people will be able to be vaccinated. And unfortunately, there is a bit of a hold up in production from the vaccine being developed by Pfizer and BioNTech. But what we know is that around just under 1.2 million people in Germany have received at least one of the vaccines so far. And generally, you have more than one, maybe two vaccinations, and around, I think, just under 50,000 have received the second vaccination. So obviously still a very, very long way to go in terms of the rollout.
In the meantime, there certainly is a continuation of the lockdown and restrictions. I mean, is the German public still behind these restrictions?
Largely, yes. Recent polling has shown that around 40% are happy with stricter measures. Around 20% would have liked them to have stayed as they were before they were extended by a month. But around a third are really hoping for the light at the end of the tunnel. They want restrictions to be eased or end completely. But if we're looking at the overall picture, largely, yes. Support for restrictions has been consistently high. I guess what the problem has been is that there has been there's been restrictions on what people are allowed to do in private, and that has not really happened on the workplace. So at the moment, you're only allowed to meet with one other person from another household, but generally can still go to work where there could be an office full of people. What the government wants to do with these new crackdown or these new tightening of the measures is to encourage employers to allow their employees to work from home more, so that the infection risk at the office and on public transport in commuting is significantly reduced.
And Jared, we heard the Chancellor touch on this, but she will be holding a video conference with EU leaders later today, also on the COVID-19 crisis. Tell us what's on the agenda there.
That's right. As Angela Merkel has said, she's very, very worried about these mutations, these variant strains of COVID-19 and whether they could spread across the continent. One big topic that's going to be discussed in this online conference with EU leaders is the issue of border closures. And what we know from the German government is that it would prefer not to have to close borders to neighbouring countries, but it isn't ruling it out. And so if neighbouring countries aren't able to get infection levels under control, then the German government isn't ruling out having to close borders to those neighbouring countries, though it is saying it would rather not have to do that. It would rather that the entire bloc come up with a coordinated strategy in order to keep infection levels down and reduce even further as the pandemic progresses.
All right, our political correspondent Jared Reed covering this story for us as the Chancellor answers questions on her government's COVID-19 strategy. Jared, thank you so much.
The number of daily coronavirus cases here in Germany shows no sign of decreasing either. In the last 24 hours, more than 20,000 new infections have been recorded and more than 1,000 people have died. Chancellor Angela Merkel is expected to hold a news conference today concerning new measures aimed at curbing the virus. Ahead of that, DW's Michaela Küffner caught up with Merkel's Chief of Staff, Helga Brown.
And with me now is Angela Merkel's Chief of Staff, Helga Brown. On Thursday, EU leaders will be gathering virtually to discuss the next steps in beating corona. Will border closures and more border controls be on the agenda there?
In the end, that would be the worst way to go. Because what is it we're trying to achieve? We want to bring down the numbers in Germany. We want our health authorities to regain control over the chains of transmission, and then we want to reopen. That is exactly what made us successful last year. After the lockdown, we had incidence rates of 2, 3, 4, 5. A lot of people forget that. Now there are people who are saying they can't believe it's possible to get the infection rate below 50. I believe it is possible. I believe that with the measures we're now taking, we can do it. And then we will need to defend that success. We need to make sure that it can be sustained, that in conjunction with the effects of spring and the vaccine, this allows us to return to normality and that we don't face renewed problems, especially through a highly infectious virus mutation that is even harder to control. I believe we all want to avoid that, and that's why stricter immigration measures, when a neighbouring region has become a host to mutation, simply can't be avoided.
Now, the United States has been following a America First policy also when it comes to vaccinations. That goes back to a presidential order from the 8th of December. It makes sure that every American has to be offered vaccination before any of those vaccines leave the country. So what will your request be on this issue to the newly inaugurated President Joe Biden?
The European Commission is currently in talks with the companies involved. And if that helps us find a solution, then of course we will discuss that with the US administration. There's no question about that.
Now, the World Health Organization is criticizing that it's the rich countries who are getting access to vaccines first. What are you doing for poorer countries?
Just as we ordered the vaccine through the European Union, so too we are taking part in a joint initiative together with the European Union. The European Commission will address this topic. How to provide the vaccine to third-party states, especially poorer countries, will be atop at the European Council on Thursday, including the question of how we can still do more beyond this COVAX initiative.
Helga Brown, Chief of Staff for German Chancellor Angela Merkel, thank you very much.
Sehr gerne.
Here's a quick look at some other developments in the global pandemic. China plans to impose strict COVID testing requirements during the Lunar New Year holiday season when millions of people are expected to travel. The country is battling the worst wave of new infections since last March. The Netherlands will ban flights from the UK, South Africa and South America beginning Saturday for a month. The country is also set to debate a nationwide curfew aimed at curbing infections. And Australia has recorded a fourth day of 0 cases. This comes a day before new rules go into effect requiring international visitors to test negative for coronavirus within 72 hours before departure.